Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We have now administered more than 149,000 doses of the vaccine, and more than 54,000 Albertans are fully immunized with 2 doses. Over the last 24 hours, we have identified 263 new cases of COVID-19 and completed about 5,200 tests. This puts our positivity rate at about 5%. This is an increase from where we have been in the past few weeks, which is concerning. It is possible this increase is because of changes in who went for testing over the long weekend. So we will be watching closely in the days to come to see if this is an isolated finding or a concerning trend. There are currently active alerts or outbreaks in 264 schools, or about 11% of the schools in the province. Currently, these schools have a combined total of 861 cases since January 11th. Turning to variant cases in Alberta, on Friday last week, we identified 15 new variant cases with 15 new variant cases on Friday, with 18 on Saturday, followed by 10 on Sunday, and finally 7 on Monday. This is an average of 12 new variant cases per day. I know that many Albertans are concerned about these variants, and I am too. I am particularly concerned about the growing number of cases not linked to travel, though many of these cases are the results of close contacts who we have identified through robust contact tracing. This includes offering testing twice to anyone who may have been exposed to a variant case. We are actively monitoring the emerging research on these variants and looking to see if any of our current guidelines or approaches need to change beyond the adjustments we have already made to limit opportunities for spread. There are 365 people in hospital for COVID-19, including 56 in the ICU. Sadly, 9 new deaths were reported to Alberta Health in the last 24 hours. While the number of COVID fatalities continue to trend down, these deaths are a painful reminder to all of us about the seriousness of this virus and the need to protect ourselves and each other from it. My thoughts are with anyone mourning the loss of someone they loved from COVID-19 or any other cause. It has now been 1 week since we eased Step 1 restrictions as part of our path forward. As you know, due to the lengthy incubation period of this virus, it can take up to 2 weeks to begin to see the impact of any changes to restrictions. It's too soon, therefore, to say what effect those changes are having in the province. However, it is positive news that our hospitalizations have continued to decline since our peak at the end of December. The R rate in Alberta is currently 0.85, which indicates that overall our trend in cases in the past few weeks has continued downward. While our highest case numbers are in Edmonton and Calgary, the reproductive rate and active case rates are highest outside the 2 urban zones, highlighting that no area of our province is free from COVID-19. We will continue to watch these key metrics in the coming days as they will inform our path forward. Speaking of the path forward plan, we have had some questions today that I would like to address. The first is about capacity limits for in-person service in restaurants that is now permitted in Step 1. Unlike other public settings like retail stores, we have not implemented specific capacity limits on restaurants, bars, and lounges. Instead, we have limited capacity by putting in place physical distancing protocols that require a minimum of 2 meters spacing between tables and dining parties. In addition, we have limited the number of people who can be seated at the same table to a maximum of 6, and these must be members of the same household or an individual living alone with their 2 contacts. This approach still reduces the capacity of the venue, but is based on the configuration of table distancing and limiting people at a table rather than by a percentage of fire code occupancy. This is an important distinction because unlike retail shoppers in a store, who are always wearing masks and may only briefly get close to each other in certain high-traffic areas. Individuals eating and drinking are not wearing masks, and they remain in a location for an extended period of time. This makes it critical that they are appropriately spaced from other parties for the duration of time in the restaurant. Another question we've received is about why we're not considering easing the ban on indoor social gatherings until step 3. This is a natural question to ask, especially after not being able to spend time or recent holidays with our family and friends. I too deeply miss being able to gather with my family and friends, as I know all Albertans do. But evidence shows that it's in these social get-togethers where we see the highest rates of transmission. We saw the start of our last spike following Thanksgiving, Halloween, and the gatherings that went along with these holidays. Though it's been incredibly difficult for many of us to not gather with our loved ones indoors, I believe this sacrifice has had the biggest impact on reducing spread in the province, relieving the pressure on our healthcare system, and getting us to the point we are at today. We cannot become complacent now, especially with the arrival of variants of concern in our province, and indoor social gatherings present too much of a risk at this point. With the weather improving, there is an opportunity for outdoor social gatherings with up to 10 people, where we can have the interaction we need in a way that minimizes the risk of transmission. Despite all of our hard work and sacrifices, which all Albertans should be proud of, Alberta still has a very high case rate, and our numbers are still higher than they were before our second wave in November and December. Looking back to October just 4 months ago, on October 17th, we had a total of 2,890 active cases. Today we have almost 5,000. On October 17th, there were 122 people in the hospital. Today we still have 3 times that amount. 4 months later, with some of the strictest measures in place, we're still working to reduce the ripple effects of our previous interactions. These numbers underscore the power that our actions have. Power that can lead to uncontrolled spread if we are not vigilant, or power that can slow transmission down when we work together and follow the rules. We all need to stay the course and continue to make choices every day to reduce our in-person interactions, especially indoors. Thank you, and I'm happy to take questions.
All right, we have a very full queue, so we will limit it to one question only, but we will try to get through as many as possible. Operator, could you put through the first caller, please?
The first question comes from Kevin Nimick of CTV.
Hi, Dr. Hinshaw. A Calgary City Councillor is pushing for city frontline workers and first responders to be prioritized in the Phase 2 vaccination schedule. Who do you specifically want to see vaccinated first once Phase 2 begins, and when will we see a schedule?
It's really important as we're considering the sequencing of vaccine availability to remember that with limited supply, choosing who is in that sequence is of very critical importance, and that our goal right now is to prevent severe outcomes, to prevent hospitalizations, to prevent ICU admissions, and to prevent deaths. With that in mind, we are looking, as we have since Phase 1, at evidence around who is at highest risk of those severe outcomes to inform some of that sequencing. Final decisions have not yet been made. I anticipate that there will be information forthcoming about the sequencing in Phase 2 within the coming weeks. I want to emphasize again that choices around the sequencing of vaccines is not about the value that people bring to their work, to the society. What it is about preventing deaths, preventing severe outcomes like hospitalization, and wanting to make sure that as we're sequencing, we're doing that in a way that protects those at greatest risk of those severe outcomes.
Operator, could you put through the next caller, please? Operator, are you there? Please bear with us while we try and sort out the technical difficulties. All right, we will try this one more time. Operator, are you there?
Hi, sorry, our main operator lost their connection temporarily. Next is Eva Ferguson with the Calgary Herald. Go ahead, Eva.
Yes, thanks, Dr. Hinshaw, for taking my questions. I'm hoping you could expand your comments on variants, please. You mentioned how many variant cases were confirmed on each individual day over the long weekend, but I don't think you gave an overall total of how many we're at now since the last total, which was last Friday, I believe, at 156. And I'm wondering if you could speak as well about variants in schools and whether there are any linked to schools right now. And if and when they are, I'm wondering why the public is still not being made aware of which schools have variant cases and whether you think that would serve to improve vigilance in the greater community.
With respect to the overall total number of variants that we have, again, we had an average of 12 cases over those 4 days with a total of 50 cases over those 4 days. All of those new cases were B117, so we still are sitting at 7 of the B351, which is the one that was originally identified in South Africa. So we've seen no additional cases of that particular variant in the province for many weeks. The other variant, the B117, again, is that particular variant that we are seeing cases of. The question about schools, we have seen another school where there has been documented in-school transmission of variant cases of a small number of cases. In the cases where we have seen in-school transmission, there have been small numbers as a result, where we have again, seen within a classroom that there has been a small number in a couple of schools where the original case came in, there was an exposure, and then through further follow-up, we have identified those cases to prevent further spread. I'll have to confirm the numbers, and we can get those to you later today, but it's my understanding that we now have 3 schools where there has been some in-school transmission, and all the other schools where we've had an exposure that we have not documented any in-school transmission, which leads to that next question of why we are not differentiating schools with variant transmission over and above schools with transmission of the COVID dominant strain that we currently have in the province. And it is because, again, we are not seeing in school settings particularly, we're not seeing a different behavior of this particular variant, and that could be because of all of the precautions that are in place in schools, where we're not seeing any difference, where the majority of cases we have an exposure with no onward transmission. In a small number, we're seeing a small handful of secondary cases, but again, no large exposure events in schools. So we do continue, as we always have, to post schools where there are any COVID case exposures or any COVID cases transmitted in school, with the total number of all cases either active in exposing infectious while in school or those who potentially acquired it in school. The total numbers are available on our school website. But again, the risk does not seem to be any different within that school, whether it's variant or not so far in our experience. And so we're not differentiating on our website between those 2 kinds of exposures.
Operator, could you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. We heard Newfoundland warning rotational workers about outbreaks in other provinces over the weekend, singling out oil facilities in Alberta specifically, and they're tightening their isolation requirements. Have there been any instances that you're aware of rotational workers in Alberta taking COVID-19 home with them to Newfoundland or other provinces? And what work is being done here to track the extent of that?
We always work with other provinces across the country whenever there is an outbreak identified in a site that has workers coming in from outside the province. And that's true of other locations. So in other provinces, they have similar kinds of facilities, and we work with them when people who live in Alberta have gone elsewhere to work in those locations. We know that in the outbreaks that we currently have, where there's been recent cases in the oil sands, that there have been no variant cases identified in those outbreaks. And so it's clear that with respect to the issues that Newfoundland and Labrador have identified with variant cases. There's no known linkages, again, between the outbreaks or the cases that are currently in those work camps and the issues that are being identified in Newfoundland and Labrador. It is, of course, critical that all of us follow all the rules, and when we're traveling interprovincially, as may be the case for those who live elsewhere and work in Alberta, that they need to know what those rules are when they go home to their province, and some provinces have instituted that 14-day quarantine, so that those individuals who go home will need to follow those rules. And again, we do work closely with all of our interprovincial and territorial partners to make sure that if we do have any indication of risk, we are communicating that to them in a proactive way and working together to minimize any potential for transmitting the virus outside of the province.
Operator, could you put through the next caller, please?
Next is Jesse Wisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. Thanks for taking my question. First dose appointments are starting up again. How quickly will the province be able to finish up Phase 1A? And again, with more consistent vaccine deliveries, at what point can Phase 1B start, and how will those appointments be made and carried out?
We're very excited that this week we're starting to see increased shipments again of vaccine, and that we do anticipate that will continue through the month of March. So we're hoping to be able to move very quickly through the remainder of those Phase 1A individuals, and to be able within the coming weeks to initiate that Phase 1B and offer to community seniors. I know there has been keen interest in knowing exactly when that will start and exactly how people can book appointments, and I expect that information will be coming very soon, so people know more detail about what to expect and how they'll be able to access vaccine for seniors who are 75 and over.
Operator, could you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Just a quick clarification first and then a question. You mentioned that you were concerned with how many variant cases are not linked to travel. So how many, as it stands right now, are not linked to travel? And then my question is, what are the possible adjustments that are being looked at to mitigate variant spread? You mentioned a couple of weeks ago conversations were taking place between provincial public health leaders on precautions that could help protect against the variant. So have those been decided yet?
With respect to the travel versus non-travel, we haven't been able to finish the investigations for those cases identified over the weekend. So when looking at the cases that we do have those complete investigations for, it's about half and half. So roughly half of the cases we have are travel or a close contact of a traveler, and then roughly half are those who are either community where we don't know the source, or someone who is a close contact of that community case. Again, with that half that are overall community acquired, about a third of those are those who we don't necessarily have the source, and about 2/3 are the result of our investigations around those cases to identify those close contacts to prevent further spread. So again, it is the minority of all of our cases where we're identifying those that we don't know a source. And then part of those investigations that we're doing is turning up those additional cases so we can prevent any further onward spread. With respect to the interprovincial discussions on any additional measures that may need to be taken, we have not yet reached a national consensus. We have in Alberta implemented a few things already because we saw from our own data here that we were needing to take a stronger approach towards the individuals who had a case of variant of concern, that if they were isolating in their own home, that we would need to treat individuals who were in that home with them at the same time as close contacts for the duration and consider them exposed throughout the duration of that case's isolation period. So we have implemented that already. We've also implemented double testing for all close contacts. And we're looking at whether or not there may be some additional pieces that need to be put in place, but final decisions have not yet been made for those. We, again, have implemented those interventions where we've seen the risk to be highest, and now we're considering whether or not there may be additional pieces to further reduce risk of transmission.
Operator, can you put through the next caller, please?
Next is Dean Bennett with the Canadian Press. Go ahead, Dean.
Thanks. Hi, Dr. Hinshaw. I have a question for you on Grace Life Church. I think you'll be able to answer it because it's more touching on broad policy. The pastor of the church this weekend, in his sermon, he actually finally addressed the core concern that the government has, which is the pandemic could overwhelm the health system. The pastor told his congregation, yeah, he's concerned too, but if it happens, we can solve it just by everybody volunteering to help out. I'm not sure what he means by that, but if the health system's overwhelmed, can we actually solve it through mass volunteerism? That's my question.
Thank you for the question. What is needed to care for patients who have COVID-19 is specialized care. Particularly, we know that intensive care units often become a pressure point, and we're certainly a pressure point when we saw our numbers rise in December when we had our peak numbers in hospital and ICU. And the types of care the type of care that is required in those locations does require specialized skill sets. It requires specialized physician training, specialized nursing training, respiratory therapist training. So while I'm sure there are many people who would be well-meaning and interested in helping out, unfortunately, the types of specialized care that we need to provide when we do have higher numbers of cases leading to higher numbers of hospitalizations and ICU admissions is not the type of care that can be provided by a volunteer.
Operator, can you put through the next caller, please?
Next is Lauren Krugel with the Canadian Press. Go ahead, Lauren.
Oh, hi there. I have a question about the outbreak at the Olymel pork plant in Red Deer. Given that 60% of the workers there have jobs outside the plant, I'm just wondering if you knew how many other workplaces might have been affected and what measures are in place to make sure that, this outbreak doesn't spread to those other workplaces, particularly in healthcare.
I've been in contact with my colleagues at the local level who've been doing a great deal of work to make sure that all of the workers who do have jobs at the Olymel plant are offered any supports they may require for isolation or quarantine, offering testing, and making sure that the risk of any spread into these other work sites is reduced as much as possible. And so local public health is going to be making sure that there's offers of help that are done in culturally appropriate ways, with offers if there are language barriers, that those language barriers are addressed, that people do understand there is financial compensation for those who aren't able to work because they have to be on isolation or on quarantine if they're a close contact, so that people know that they do have whatever supports they require to help prevent that spread. And there is an intensive outreach happening right now to make sure that all of those individuals who are impacted know all of the supports that they have available to them.
Operator, can you put through the next caller, please?
Next is Shalon Skolsky with CTV. Go ahead, please.
Hi, Dr. Hinshaw. Thanks for taking my question. Also relating to the Olymel meat processing plant, with 342 cases now linked to it, I'm wondering why didn't AHS step in and shut down the operation sooner?
It's important to remember this particular plant has had sporadic cases, one or two at a time, for several months, and the processes that have been put in place at the plant site had been very successful in preventing any kind of spread. And in fact, there had been no cases for some time, and there was consideration of closing down that outbreak. Unfortunately, I think there were a concurrence of a number of events that were not limited to events directly on that plant site, and therefore we did see an increase in cases. The local public health teams have been working very closely with the plant and to be able to provide information to employees. But unfortunately, it seemed that confluence of events that involved activities not limited to what was happening on the work site, and the transmission events that happened again, not necessarily directly on that plant site, but in other locations as well. And because of that, of course, there has been an increase in numbers. And as I mentioned, Alberta Health Services is working closely with local primary care networks and other partners to make sure that every service and support that needs to be provided to these individuals is provided to them. But as I mentioned, for many months they've been working to make sure that that work site is safe and following all of the protocols. And for many months there were no significant transmission events that had happened.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Next is Rafi Boujakanian with CBC. Go ahead, Rafi.
Thank you. Hi, Dr. Hinshaw. I know the province has repeatedly said it prefers an education-first approach when it comes to public health orders and the importance of following them. We've now seen video of Calgary police letting an anti-mask protest go through Chinook Mall, an officer even shaking hands with one of the protesters. We've seen weeks in a row of multiple people breaking public health orders and capacity limits by going to that Edmonton area church, and then the RCMP and AHS only fine and lay charges against the pastor of the church. Nearly a year into this pandemic, what will it take to admit an education-first approach is not working?
It's important to remember that while disappointing, these incidents are not the majority of Albertans, and that we have seen in instances, again, I'm in contact regularly with my colleagues at the local level, and that when they are doing their daily work, that there are many instances where taking a support and education approach to individuals who are not following public health orders, that there are many cases where that first step does result in better partnership with those individuals. Of course, when that fails, it has always been supported to take the steps that are necessary. And again, those decisions are made by the independent officers in Alberta Health Services and law enforcement officers to enforce in the ways that they believe appropriate according to their training and their professional conduct. And that's not something that I interfere with, but it is up to them to escalate to enforcement when that initial step of support and education does not work. In the instances that you've mentioned, again, I would reiterate my disappointment, particularly in communities that choose to put other members of their community at risk. And I would again reiterate that the vast majority of Albertans, the vast majority of faith communities, the vast majority of businesses are doing the right thing for the province. They are doing the right thing for their communities, and they are taking the steps they need to protect against COVID-19 spread. And when enforcement is needed as a tool against the groups and individuals for whom that education and support approach has not been successful, then that enforcement approach has always been a tool that can be used as deemed appropriate by those local enforcement officers.
Operator, could you put through our second last question, please?
Next is Lauren Pullen. Actually, I'm sorry, it looks like Lauren's left the queue. One moment, please. Next is Elise Stolte with the Edmonton Journal. Go ahead, Elise.
Thanks. Hi, Dr. Hinshaw. Just following up on the question about Phase 1B, I have a couple of basic questions. When you say age 75 plus, is that by birth date or by the year in which you turn 75? And 2, are you planning an active outreach to call or otherwise contact people when they're eligible? Or are seniors expected to hear about the opportunity and contact you? And 3, especially as other vaccines come online, will there be a choice of vaccine? So birth date, active outreach, and choice of vaccine.
Thank you. The first question, it's based on year of birth, so not necessarily the month, but that year is the determination of eligibility. The second question about outreach, we are going to be working on a plan that will have, we are currently working on that plan that's going to enable people to know when they're eligible. So it's not just about waiting for people to reach out to us, but also looking for opportunities to partner with other healthcare professionals to make sure that people know when they're eligible. And again, details about that will be coming in the upcoming weeks about how people can sign up, when they will be eligible. The question about choice is one that's not yet been fully landed. At the moment, we have Moderna and Pfizer, which are very similar in terms of their protection against symptomatic infection, their protection against severe outcomes. They are both the same technology, and so at the moment, we do not offer a choice. The Moderna and the Pfizer are treated not interchangeably. If you start with one, you would finish with the one, but people would have to accept the product that is available in the particular site where they're receiving their vaccine. And the question about whether or not there will be a choice has not yet been determined. We're looking at all of the other products, but of course, as you know, there are no other products currently licensed for use in Canada, and it's only at the time of licensing where we will have the final information about how different vaccine products are to be used, and so we would have to wait for that before we can make any final decisions.
Operator, can you put through the final question, please?
Final question is Anna Yunker, the Edmonton Journal. Go ahead, Anna.
Hi, Dr. Hinshaw. We've heard that about 9% of Albertans who test positive for COVID-19 are returning to work the next day. Are you aware of this, and what is your response to those who are not isolating?
I'm not sure what source that information comes from. We did know that in the fall when we were doing aggregate data from individuals who tested positive, and the follow-up of those individuals when they tested positive did indicate that at that time there was a significant proportion who reported that they did attend work while symptomatic before they went for the test, but I'm not aware of any recent data, so I'd be interested in the source that you're citing in terms of that 9%. What I do know is that when public health contacts individuals who've tested positive, they clearly express the requirements, that it's not just a recommendation but a requirement for those individuals to be isolated and to not go to work, that they ask about the need for supports for isolation hotels, for example, if that person is not able to safely isolate at home, and make sure that they're aware that there is currently financial support, not just from the federal government, but also the provincial government, particularly if people do need isolation hotel supports and they go to complete their 10-day isolation in that hotel. There is financial support to ease that burden for people who need to be away from others to protect their families and their communities. So every step is being taken to make sure that people, first of all, know about the legal requirement and have the supports to do the right thing. But again, I would be really interested to know where that 9% came from, because that's not a statistic that I'm familiar with and not one that I've heard from our investigators.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.